Capabilities can become endless and possibilities achieved once we decide on working towards any life goal. Jamaican nurses are working on the goal of saving lives in a pandemic, and the Ministry of Justice has decided to help children facing trauma. With the right attitude, a lot is being achieved in this small nation. This is your Jamaica Magazine with lots of content to share today. I'm Theodore Henry, ready to take you through every bit of the show. Stay connected for what's to come.
Good day, I'm Stephen McHugh, and this is your JIS News for Wednesday, June 23. Government has finalized plans to make certain state-owned venues available rent-free for the staging of large entertainment events. It's part of efforts to stimulate the reopening of the entertainment sector, planned for July 1 to August 10. The venues are operated by the Ministry of Culture and the Port Authority of Jamaica. In Parliament Tuesday, Prime Minister Andrew Holness said that with the normal rental cost waived, promoters would be responsible for operating costs, including utilities and security. Promoters of large events with over 100 persons expected will be required to make an application to the Ministry of Culture. The ministry will review the application in consultation with ODPEM, the Ministry of Health, Municipal Corporation, the police, and other relevant authorities. Persons staging small events with no more than 100 persons in total will benefit from a 50% reduction in permit costs from the municipal corporations. Prime Minister Holness says the Ministries of Culture, Economic Growth and Finance will also be exploring other stimulus to realize growth and development in the sector.
The entertainment, culture and creative industries represent a key part of our competitive advantage and are vital to our economic recovery and long-term growth prospects. The industry has the potential to emerge from this crisis stronger and better than before.
And as part of efforts to kick off the reopening of the sector, government will stage a concert on July 1 at the Port Royal Cruise Pier in commemoration of International Reggae Day. In the meantime, Prime Minister Andrew Holness unveiled updated COVID-19 containment measures yesterday, which will remain in place between July 1 and August 11. Curfew hours have been amended to 11 p.m. Mondays to Saturdays and 6 p.m. on Sundays. Amusement arcades are to reopen on July 1. Funerals will now be allowed with a maximum of 30 persons, including mourners and members of the clergy. The attendance limit at burial services has now moved from 15 to 30 persons, with service times being extended by an hour. Measures under the controlled re-entry program remain largely unchanged. These include presenting a negative PCR test, as well as the continued travel ban on certain countries. The stay-at-home and work-from-home orders in the public sector remain in place. So too have the protocols regarding the opening of markets, gyms, parks, bars, beaches, rivers, zoos, water parks, and attractions. Starting June 24, the state will modify the existing order on places of worship and cinemas. These venues will now be allowed to host 70% of their maximum capacity. In the case of drive-in cinemas, vehicles should carry no more than the number they are registered to transport.
It has now been 15 months since the pandemic began. We have a lot more information on how the virus spreads and the protocols that are effective in reducing spread. Let us therefore not view the new measures as free for all. Let us commit to being responsible and diligent.
Registered fishermen across the island now have insurance in place to secure their vessels and accessories. The Ministry of Agriculture and Fisheries has partnered with Advantage General to introduce the Safety Net insurance package. With payments as low as $45,000 a year, protection is offered for accidental loss or damage to fishing vessels and accessories by fire, malicious acts, theft, and natural disasters while onshore or offshore in Jamaican waters. The general insurance package was launched at the ministry's Hope Gardens offices yesterday. Agriculture and Fisheries Minister Floyd Green lauded the partnership, saying it will help to provide a better sense of security for fisherfolk.
It protects them against a wide array of perils. It protects them both at sea and on land. Even when they put their vessels to be repaired, there is a level of protection that is provided. And importantly, it is affordable.
Additionally, Advantage General has crafted the AgriGen Pack, which allows for both registered fisherfolk and farmers to insure either their homes or motor vehicles at a 10% discount. A 15% discount is being offered if they insure both at the same time. In other news, just 3 days into the Zone of Special Operations ZOSO in Norwood, St. James, and the police have seized 3 firearms and made several arrests. Police Commissioner Major General Anthony Anderson says this is a positive sign compared to the 14 days it took to find the first weapon in the first ZOSO that was implemented in Mount Salem. Commissioner Anderson was speaking at a press briefing following a tour of the Norwood community yesterday.
So we're ahead of that curve now. The more we use these tools, it's the better we get at it. And I think it will redound to the benefit of the people who live here.
The police commissioner says the ZOSO intervention is warranted due to a spike in murders and other criminal activities in the area. He asserts that Mount Salem is now seen as a model community due to the impact of the ZOSO and says the same approach will be used in Norwood. And finally, Jamaica is set to host the United Nations World Tourism Organization UNWTO 66th Regional Commission of the Americas on Thursday. This will be the biggest international event of its kind the country will stage since the onset of the COVID-19 pandemic. Among the global leaders to visit the country this week for the blended staging of the event are Secretary General of the UNWTO and Saudi Arabia's Tourism Minister Ahmed Al-Khatib. In Parliament recently, Tourism Minister Edmund Bartlett said the visit would allow Jamaica and Saudi Arabia to foster greater collaboration.
They see Jamaica as a successful tourism model. And he said to me, we want to copy some of what you did here in Jamaica in the development that we're having for Saudi Arabia.
Among the agenda items is exploring areas of community tourism and cruise development, as well as sustainability and resilience. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.
For those of us who do not believe that COVID is real and that it is here, have you been to one of those hospitals where the wards are overflowing with patients who are trying to breathe and talk at the same time, but find it so impossible to do so? Or have you seen someone die in front of you, trying to make the next breath to stay alive? So my fellow Jamaicans and colleagues, whether you believe it or not, COVID is real. So I implore you, social distance. Wash your hands, wear your mask, sanitize. Along with that, we need to keep our immune system nice and healthy, so you drink lots of water, eat your fruits and vegetables. But whether we believe it or not, COVID is here, it is here to stay, it's going to be the new norm. And remember, when you behave irresponsible, you expose all of us. So do the responsible thing.
Children sometimes experience things that they shouldn't ever have to, and often what's left behind is trauma. But thankfully, many of them are getting help, and the results have been amazing. Here's more from the Victim Services Division.
Children sometimes see too much. At other times, they hear too much. And many of them feel too much. There are situations where children become victims of crimes, seeing, hearing, and feeling too much of its effect. The hurt and trauma can linger without the proper intervention strategies. This is where government's Victim Services Division comes in. The VSD is having a far-reaching and sweeping impact as it provides help to this vulnerable group.
The Victim Services Division is that division within the Ministry of Justice, which is responsible for coordinating the ministry's support base for victims of crime. Anyone can become a victim of a crime. Victims of crime are often persons who suffer just about any crime you imagine. There are sexual crimes, small children, there is robbery, there is murder, wherein the primary victim, though, has deceased. The secondary victim, which is the family members, are there for the support that we give. We recognize that our victim population was getting younger. Whilst we still would have to communicate with them some of the complex concepts that are a part of the therapeutic process. Hence, we needed to find a medium that will allow for us to use their type of language, colors and sounds and movement.
Well, that medium the ministry found was the use of an animation bundle. It is comprised of 8 short films that offer therapeutic intervention and lessons to children who are victims of crime.
Your daughter was almost abducted today, but she was smart. She ran away. However, there is more she could have done. Walking with headphones on is a dangerous habit. You must be alert. Pay attention to your surroundings and the dangers around you.
Our animation strategy involves the creation of a character called Justy. And Justy represents all that is good and right about what should be done when a child is faced with a difficulty. A child seeing the animation immediately will be able to interact. They are short animation films, so the attention span of the child is not hampered in any way. And our intent is not just for them to watch Justy, but to become and to embody the teachings, the values of Justy in order to help other children.
I have not left the house in over 3 weeks. I came here to work as a helper, and now he tells me that I'm going to work at a nightclub.
Put these on and get ready. We're leaving for the nightclub in half an hour.
Anyone can be trafficked. It does not matter your age, gender, or race.
We also ensure that we would have elected to choose specific topics which were current and will remain current. Abduction is a reality. The matter of being bullied is a reality. Human trafficked is another reality, and among others. There are 8 animation films. And these are current, we have seen over time. We have had the opportunity to have children literally vet the animations, and we are very comfortable that they have the content that will reflect concerns that children would want to share with their friends.
But why was the Victim Services Division so sure that these animated videos would have or will even continue to pull the required effect?
The process of developing an intervention involves doing an assessment. We would have had the benefit of, over the last 20 years, 200,000 victims that we would have been able to assess. We would have had clear understanding of what needs to be done to provide support for the victims of crime, hence the program VSD. What we did was to use that 20 years of experience. We have a cadre of trained social workers, psychologists, various levels of competencies to work with children. And we have just managed to package this entire expertise into 8 animations. I am absolutely confident that they have what it takes to make a difference.
So even in all the challenges, the Victim Services Division is working to provide psychosocial support for victims of crime. The division is committing its unit to the advancement of victim rights, including those of our children. And your role can be as simple as speaking up.
To properly carry out a hand rub, apply a palmful of the product in your cupped hand, covering all surfaces. Rub your hands palm to palm. Rub your right palm over the back of your left hand with interlaced fingers and vice versa. Rub your hands palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked. Rotationally rub backwards and forwards the clasped fingers of your right hand in your left palm and vice versa. Once your hands are dry, they are now safe.
What our nurses are charged to do every day isn't easy. They give of themselves so much just to allow a complete stranger to live for tomorrow. And If that wasn't already enough, a pandemic forced them into providing more of themselves. But there are some who would never change any of that. We'll meet a few of them right now.
Your first glance, and it's quite easy to describe a distinctive, often immaculate and largely undecorated attire. Quite mundane for many, but their lives are far from the mundane. It's one that's quite astonishing most days, while other days come with its own bit of terrifying events. Really, there's nothing humdrum about their jobs.
Hi, my name is Dominique Millen and I have been a nurse for 13 years. I chose nursing as a career because as a teenager, I experienced a devastating loss. At the time, I could not cope with the feelings I was experiencing, so I saw a way I could help the helpless. As a nurse, I love being a part of a medical team that goes above and beyond to save patients to life. It is amazing to see the things that people do when you work together to achieve one goal.
My name is Lillian Cook. I'm an acting ward manager, a registered specialist nurse working at the Bustamante Hospital for Children for over 20 years. The word nurse to me means caring, helping those who are sick, and the greatest pleasure is to bring them back to health. When I was a child, growing up, I wanted to become a nurse. And at about the age 11, I read about Florence Nightingale. And that story was so inspiring, the lady with the lamp. And I decided in my mind from there that that's a profession I would choose for life.
So many of them stood and continue to stand as the backbone of the frontline workers in a pandemic that we knew too little about, while dealing with unprecedented strains and wounds that not even their gauze or surgical tapes could ever cover.
I remember the first time I heard about the COVID-19 virus hitting the shores of Jamaica. I knew this was it. My name is Norwood Mendez, and I have been a nurse for 14 years, and I have never experienced anything quite like the pandemic.
Working as a nurse during the pandemic at the hospital, it is very overwhelming to see that our medical resources have been stretched thin, and it is very devastating to see that family members can't be with the patients here.
Working in the pandemic has been very taxing emotionally and physically. The work demand becomes very hectic. You have to show up, you have to give the same amount of care, irrespective of the fact that the patient has a contagious illness. You work long hours, longer than normal, because sometimes there are staff members who are on quarantine or who have been exposed to the virus. And so you must now sometimes double up your time in order to give the care that the patients require.
I lost a colleague to COVID-19 last September. It was very, very difficult for us as colleagues to bear the news, feel the pain, especially when that person was so warmed. It was panic-driven. And when I heard that people were just dying, as if there was nothing that could spare life, it was really panicky for us. But when it came to our shores and we saw that people could really recover, yes, it touched us when we saw loved ones died, when you care for persons and the end result is death. But we were much happy when we start getting positive results of people who come in, treated, and return home.
Having lost a patient to COVID-19 has been emotional for me because the patient would have been in hospital over a period of time. And so after having been in hospital over a period of time, you develop that patient-care relationship, and so the patient would appear like a family member. And so when the patient dies, a part of you, a part of you is affected.
Despite the losses, despite the faces of patients far too many to even count or recollect, persons like these continue to respond to the call to save lives daily, hourly, and with every ticking second of a clock.
So the lifelong lesson that I have learned as a nurse is that life is very fragile. You have it this minute and the next minute it is gone. And that is the reason I believe that each person should find the time to spend the time with those they love. Let them know in every way possible how much they mean to them, because life is fragile.
What motivates me being a nurse is that I can make a difference in a patient's life. I grew up with a strong family background of strong women. They always say, you turn up and show up and give your best.
I did not choose nursing. Nursing chose me. My advice to those who would like to pursue a career in becoming a nurse is that nursing is fun. It's a fun profession. You are never ever doing the same thing every day. If you are passionate about helping people to restore their health, to preserve life, to promote health, if you are passionate about humanity, this is a profession for you.
Even if I'm tired, when I go home in the evening, or at every time my shift ends, whether it's a night shift that ends in the morning, I just have this strong, compassionate feeling to continue my work. And I always look forward for the life that I'm going to touch tomorrow.
Unless you're in that room, you have no idea what we do. But I love my job.
I was meant to be a nurse.
I knew what I was getting into, but I chose it. And if I should start all over again, I will make the same choice. I'll nurse for life.
So here's a space where these healthcare providers are notorious for working long, grueling hours, giving of themselves, working tirelessly to allow someone, anyone, to see into the promise of tomorrow. A nurse's task isn't easy. So how about showing them some appreciation as we go about our daily lives?
We're still pushing the message of vaccination because the truth is there's so much we can achieve as a nation if a large number of our population becomes vaccinated against COVID-19. But if you still need some more persuading, then here you go, courtesy of the health experts.
After you get your first dose, it takes a few weeks, about 3 or 4 weeks, before your body has produced sufficient protection to reduce your risk of COVID. So if you get exposed in the week or the second week after your first dose, you could still get COVID. But once you've had 3 to 4 weeks after the first dose, the risk of getting COVID is much, much less. After you get the second dose, 7 days after the second dose, you are fully protected. And therefore, it is rare to get COVID after you have 2 doses. We already know it lasts several months, but we don't know how long it will last. For instance, the flu vaccine often lasts only a year. You have to then get another flu vaccine the following year. We're hoping that the COVID vaccine will last longer than that. Maybe you will need a booster in a year or 2 years or 3 years. That is still to be determined. But we do know that the vaccine is good, so we are optimistic that it will give you protection for a good while. If someone is sick with COVID currently, then we do not advise them to take the vaccine while they're ill. After they recover, they are going to develop immunity and protection to getting infected again. So usually we say wait 4 to 6 months, since we know that people will have immunity for at least 6 months. So we say allow someone else, since there's such a problem with the number of doses available, allow someone else to get vaccinated and they could wait 4 to 6 months. But if they have recovered and they do take the vaccine, no harm will come to them. In fact, that will act as a booster to their immune system, so they'll be even more protected than before. Someone with lupus should get the vaccine because that's someone with a comorbidity. If they get COVID, they're at risk of having more serious attack of COVID. So as long as they're not having an acute flare-up, then they should get the vaccine. If they're having an acute flare-up of their lupus, as soon as it is controlled, is reasonably controlled, they should get the vaccine.
You have a comorbidity, then therefore you are definitely on our priority listing. So I want to encourage you to continue to build your immune system, eat right, certainly get some sun in the day, a lot of sleep, so that when it's your turn, your system will be ready to accept the vaccine. Thank you. It is a conversation to be had with your physician as to your current robust status. So if you are well, you are not having a flare at this time, then yes, you ought to take the vaccine.
Last year, we saw over 13,000 victims. However, I am conscious and I'm aware that there are many more. There are children, there are victims in our community that are struggling with the reality of crime and trauma. Some of them individually and directly, and some of them indirectly in the community which they live. I would like to challenge you who are listening, watching this program, to make an effort to call the VSD, the Victim Services Division in the Ministry of Justice. Encourage these children to get help. Cause us to know so we can reach out to them to get help. The numbers to call are 876-618-3620 or 876-946-2014. Healing and justice for all victims of crime is not just our concern, but it should be the concern of all of us.
This is never really my favorite part of the show, but it's where we close things off. But there's always the reassurance of a new Jamaica magazine coming tomorrow, same time, same station. So until then, how about rewatching this and other editions on our YouTube channel? You can also visit our Facebook, Instagram, or Twitter pages, along with the JIS website for more information. On behalf of the entire production team, I'm Theodore Henry. Thanks for watching, and do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.